here to talk about HIV. HIV is one of the world's most serious health challenges.
Where does HIV come from? For some of us who remember the sudden emergence of HIV into the popular culture and awareness of the US in the early 1980s, HIV appears to have come from nowhere. Rumors swirled about where it came from, how it came to infect people from all walks of life around the world. It's only now, after over 25 years of research and discovery, that we can finally start to say with some confidence where HIV came from. HIV is a lentivirus on the basis of its genome and life cycle. It's not all that unusual for the lentiviruses. It infects immune cells, primarily CD4 positive T cells and macrophages. The other lentiviruses pursue similar, if slightly different, life cycles. There are lentiviruses that infect cats, goats, horses, sheep, cows, and monkeys.
HIV stands for Human Immunodeficiency Virus. It's one of the most serious health challenges in the world. It affects all ages, all sexes, and all races.
HIV is transmitted through vaginal and anal sex. It is not transmitted by hugging, kissing, tears, sweat, none of those.
It can also be spread through certain body fluids such as blood or breast milk. Without proper treatment, HIV can lead to AIDS. Untreated HIV attacks your immune system and allows different types of life-threatening infections such as cancer to develop.
By the end of 2016, 36.7 million people were diagnosed with HIV, whereas in 2017, 19.6 million people were diagnosed. This is just coming in from my friend Jessica over at Montreal. In 2017, 19.6 million people were diagnosed with HIV.
That decreased so much.
In 2006, men made up 3/4 of the people living with HIV in the US, whereas women made up 1/4 of the people. As of today, people are able to live longer lives with HIV as long as they have the proper treatment. Thank you for tuning in with us at Bridgewater News. I'm Mary Nunes.
And I'm Natalia Tony.
Thank you for checking in.
Today we will talk about early signs of HIV in women. The infection and AIDS has been declared an epidemic since 1981. According to the World Health Organization, 47% of HIV-infected adults are women. Although it affects more men than women, the risk of women getting HIV will increase if the current rate of HIV infection cases continues to escalate. In this video, you will learn what the early signs of HIV in women are, and other facts you may want to know about HIV and AIDS. How HIV works. Let us first talk about HIV before proceeding to the common signs of HIV in its early stages. The lentivirus, named human immunodeficiency blood transfusion, is another major agent of HIV transmission, along with the use of infected syringes or needles. Lastly, what the HIV virus does to your health is that it weakens the immune system. HIV attacks the white blood cells which protect the human body from foreign organisms. The longer you are infected, the less effective your immune system will be. AIDS is the stage where HIV infection is no longer controllable. At this stage, weeks after infection. Early signs of HIV in women. It is important for women to know about the early signs and symptoms of HIV infection, because early diagnosis can increase life expectancy of the infected patient. Healthcare specialists have developed treatments and therapies that are more effective if HIV infection is detected early enough. In the U.S., the Department of Health and Human Services Minority AIDS Initiative are working hand in hand with the government in order to help prevent women from getting HIV infection. Initiatives such as demonstrating projects on women's social networks, conducting outreach and testing programs, and providing funds for prevention programs for the local health departments and community-based organizations. It has been shown that women tend to neglect their health because of work, household chores, or prioritizing children, and is the main reason why women occur as early as 2 weeks after infection. Cough, diarrhea, dizziness and fatigue, fever, night sweats, muscle and joint pain. Meanwhile, here are the common early signs of HIV in women. Anorexia, delirium, depression, loss of concentration or forgetfulness, body fat changes, anxiety, yeast infection, weight loss, difficulty in breathing. Note that not all women who have HIV infection experience all, some, or one of the signs and symptoms of HIV as stated above. It is on a case-by-case basis and every woman is different from another. It is also worth noting that women who are HIV infected may find themselves suffering from abnormal menstrual cycles along with the previously enumerated early signs of HIV in women. Abnormal menstrual cycles may begin with one or more missed periods with a worsening over time, until the woman is unable to have her period at all. According to research, cancer and heart disease, developed because of AIDS, are the two main reasons why women die of a serious HIV infection. It is not known exactly when the early signs of HIV in women will appear. As mentioned earlier, some people experience these symptoms earlier as compared to others. Not all infected individuals suffer from the early signs of HIV either. It is best to consult a doctor immediately.
Welcome. We are live from Bridgewater Hospital, and I'm Mary Nunes, and I'm with an HIV patient by the name of
Jessica.
So, when did you find out that you had HIV?
I found out that I had HIV when I went for my regular doctor's
So,
check.
how were you feeling at the moment?
I was shocked because I'm married for 10 years now, so it came as a surprise.
So, how did you get this disease?
My husband was being unfaithful at the time, and I didn't know about it, so that's how I found out.
So, what was your next step after you found out you had HIV?
After the doctor told me that I had to talk to my husband about it and tell him to come in, because if he didn't, I'm not sure he knew he had HIV either. So we had to schedule.
So, did you start treatments right away?
Yes, I started treatments right away. I didn't want to cause any more problems because I didn't know how long I had it for. So right now I'm 7 months pregnant.
Did the doctor say that it would affect the baby? Would they become HIV positive or?
Yeah, he told me right now I've been on medication for about 2 years now, and he told me that I have to have a C-section in order for the baby not to get HIV.
So are you and your husband still together, or are you guys protecting,
Yes, we're still together. He's taking the medications just like me, so we're both on the medication.
So as a pregnant woman, what are some of your worries for your child?
I'm putting my child first, so when the doctor said C-section, I said go for it, but I'm really scared for C-section because this is my first child, and I really wanted to have like a regular natural birth, but that's not possible, and I understand that, so I'll go with the C-section.
So as some of you guys know, HIV can be transmitted through breast milk. Will you be breastfeeding?
No, formula. I'll be using formula.
So when are you due?
I'm due January 21st. That's the scheduled C-section. So.
Boy or your bundle of joy.
Thank you.
2 degrees Fahrenheit. If fever occurs at all, is often accompanied by other usually mild symptoms, such as fatigue, swollen lymph glands, and a sore throat. At this point, the virus is moving into the bloodstream and starting to replicate in large numbers. As that happens, there is an inflammatory reaction by the immune system. Night sweats. About half of people get night sweats during the early stages of HIV infection. Similar to the hot flashes that menopausal women suffer, they're also hard to dismiss, given that they soak your bedclothes and sheets. Achy muscles, joint pain. ARS is often mistaken for the flu, mononucleosis, or another viral infection, even syphilis or hepatitis. That's not surprising. Many of the symptoms are the same, including pain in the joints and muscles and swollen lymph glands. Fatigue. The inflammatory response generated by your besieged immune system also can cause you to feel tired and lethargic. Fatigue can be both an early and later sign of HIV. Nausea, vomiting, diarrhea. These symptoms can also appear as a result of antiretroviral therapy and later in the infection, usually as the result of an opportunistic infection. Diarrhea that is unremitting and not responding at all to usual therapy might be an indication. Nail changes. Another sign of late HIV infection are nail changes, such as clubbing, thickening and curving of the nails, splitting of the nails, or discoloration, black or brown lines going either vertically or horizontally. Dry cough. A dry cough was the first sign that something was wrong. He at first dismissed it as bad allergies. But it went on for a year and a half, and kept getting worse. Benadryl, antibiotics, and inhalers didn't fix the problem. Neither did allergists. So be careful and consult the doctor as early as possible. Sore throat and headache. As with other symptoms, sore throat and headache can often be recognized as ARS only in context. Cold sores or genital herpes. Cold sores, oral herpes, and genital herpes can be a sign of both ARS and late-stage HIV infection. And having herpes can also be a risk factor for contracting HIV. This is because genital herpes can cause ulcers that make it easier for HIV to enter the body during sex. Weight loss. A person is considered to have wasting syndrome if they lose 10% or more of their body weight and have had diarrhea or weakness and fever for more than 30 days. Weight loss is a sign of more advanced illness and could be due in part to severe diarrhea.
Stay tuned for our next interview with Daniel, who is our HIV positive patient. Welcome back. We are here at the hospital with another HIV positive patient who goes by the name of
Daniel.
So Daniel, how old were you when you first found out that you had HIV?
I was 15.
So how did you come upon this disease? How did you get it?
Actually, I was going decided to do sports. I went for physical, and then I found out that I had it.
Were you practicing unsafe sex, or was it like needles? What? How did you?
Sex.
Okay. So, are you currently in a relationship?
No.
But if you were to be one, would you tell the person that you were with that you have HIV? Do you think they would be accepting of it?
I would. It depends on the situation I'm not.
So, how did you feel about having HIV? I mean, you're so young, you have your whole life ahead of you.
I just live my day like I don't have it.
So, what was your next move after finding out that you had HIV?
My next move is to, I guess, trying to take care of it and stay alive.
So, did you start treatment right away, or did you talk to your doctor about your next moves? What did you do?
Yeah, I talked to
So, do you have any messages for our viewers out there?
Yeah, stay protected and always get tested.
All right. So, thank you for watching our segment here with Daniel. It was nice meeting you.
Nice meeting you too.
Thank you for tuning in with us at Bridgewater News. I hope that you enjoyed our segment on HIV and stay protected out there.